Women who are leaking frequently wait quite a long time, in many cases years, to show up for an appointment and show up feeling embarrassed. They feel like if they're leaking and they're wearing pads, they feel like they're either very old or they're infants, and no active, robust person wants to feel that way. Often we have the patients construct a diary, something that they can write down with a pen and paper that explains to me and to them what's happening during the day. When are they leaking? What are they doing when they're leaking? What are they doing when they're not leaking? How often are they using the bathroom? How often are they waking up at night? Like I said, it's very eye-opening to the patient and to us when we're able to look at that and get an idea of really what's going on. We ask patients, tell us a little bit about your medical history. Do you have any things that you see the doctor for frequently? Have you delivered children? Have you had operations on the pelvis? What have you done on your own to try to make the problem better? We go over lists of medications that patients are on that may impact on their bladder control. We just try to get an idea of what's going on in the patient's life. And because we've seen a lot of patients with urinary incontinence and we focus on incontinence, it's usually pretty clear after the first visit at least what direction things are going to go with the patient. There's a very ordered stepwise process of treatment. What we've tried to do is to organize things so that when we see certain kinds of patients, we're offering them simple treatments, ideally without even medication, and then moving on to more complex treatments only when the simpler treatments haven't worked. Some of the examples of treatments that we have available to patients are behavioral modifications, simple things like changing how much fluid they take during the day, what time they're drinking fluid, what types of fluid they're drinking, how often they're using the bathroom. We use simple things like prompted voiding, which is to remind them every 2 hours to be using the bathroom. We have biofeedback treatments that are available to patients that are non-invasive. And then we have patients follow up and we say, with some simple things, how have things changed? Are you better? Are you as good as you need to be? If they're not doing as well as they'd like to do, we sometimes need to perform testing that uncovers the bladder function, sort of like an EKG for the bladder, a way for us to understand what's happening at the moment they're leaking, what's happening in the moment they have to run to the bathroom in a hurry. Simple testing that can be done in an office setting can really be eye-opening to the patients. If we identify that there's a problem, that simple maneuvers haven't helped, there are frequently once-a-day medications that can really alleviate symptoms. And it's only when we've gone through those variety of treatments that we talk about procedures and operations. Virtually all the procedures and operations we do to alleviate leakage can be done same day, usually with a brief anesthetic.